Welcome to Orthodontic Smiles, the podcast designed for all dentists and their staffs who practice orthodontics. This podcast is brought to you by the American Orthodontics Society. Something a little different on Orthodontic Smiles Podcast today. I'd like the opportunity to take a few minutes to talk to you about a few little things, and then at the end I'll give you a little advice on how I do my consultations in my office. And I think that might help you a little bit as far as the ability to be able to convince patients or parents the need for treatment. But first, woke up pretty excited today because next week, I'll be traveling to San Diego, California for the American Orthodontics Society meeting, our annual meeting. It's going to be held at, I think it's the Paradise Point Resort in San Diego. Beautiful place. I think we've been there once before, I think about maybe 9 years ago, but it's a gorgeous resort. But I'm most excited about the speakers we have this year. For a small organization like ourselves, we managed to get some pretty famous people to come and speak to us. Starting off on Thursday, the September 13th, we got Gordon Christensen, and I had the pleasure to do an interview with Gordon Christensen on this podcast back a few months ago, and he was just awesome to be able to talk to. I refer to him as one of the luminaries of dentistry, and there's no doubt about it. He is that. His curriculum vitae is pages and pages long, but he's one of the most down-to-earth guys to talk to, and he's coming to our meeting, and he's kind of pinpointed orthodontics, especially GP orthodontics, in his discussion and things he's going to be talking about. He considers it to be a fast-moving, bottom-line lecture that I think we should all be very, very proud to have him come and speak to us. The next guy is going to be speaking in the afternoon on the same day is a friend of mine who I've met a couple of years ago, and we'll be interviewing him at our annual session, and that's Dr. Joseph Yosefian. What an interesting man. What a brilliant man. And he's going to be speaking on pediatric sleep apnea, the new concepts in etiology, diagnosis, and treatment. I think this is the newest and best thing that we've got going for us as GP orthodontist and pediatric dentists, because he outlines his treatment modalities, and they are remarkable. I've heard him lecture a couple of times now. And you will be amazed at the unbelievable information you will get in a short period of time from Dr. Joseph Yosefian. Then on Friday, the 14th, another one of our interviewees, Dr. Juan Echeverry. And Juan is going to be speaking on the title, I think it's cute, The Elephant in the Treatment Plan. Impacted canine management. Well, Juan, as you know, is probably the most innovative guy in the use of TADs. So I think probably some of his lecture will be on TADs and how he uses them on impacted teeth. Those three guys right there will give you more information than just about anybody in the world at any meeting that you could possibly go to. But throw another one in on that Friday afternoon, it'll be Saturday morning, Dr. Leonard Carapeza. He's going to be speaking on improved aesthetics through better occlusion. Lenny Carapeza, is, we refer to him as the father of early treatment orthodontics, and another one of our interviewees on Orthodontic Smiles Podcast. We've been blessed to have some really, really fine people being interviewed on Orthodontic Smiles Podcast. In the afternoon on that same day, we'll be having a lecture from Dr. Bruce McFarland. Bruce is going to be talking about AP correction prior to orthodontics. The time is right, and I assume he's going to be talking about a lot of Class 2 and Class 3 correction using the Carriere appliance. He's pretty famous for lecturing about those, and we can't forget about Saturday, where Dr. Bill Wyatt will be lecturing in the morning. And then on Sunday will be another lecture from another one of our interviewees, Dr. Larry White. He was the former chairman of the Orthodontics Department at the University of Texas in San Antonio, and for 17 years served as the editor of the JCO journal that we all are so familiar with. But he'll be lecturing, and the topic of it's just going to be an orthodontic workshop, exploring the advantages of round wire and partially bonded appliances. So that, I think, is going to be one unbelievable annual meeting, and I'm so looking forward to going to that. One of the other things we'll be doing is we're going to be taking the podcast microphones to the meeting and getting some good interviews from some of the members as well as some of the speakers that will be speaking, and we'll have those interviews for you in the weeks and months to come. Speaking of Orthodontic Smiles Podcast, I just have to say thank you to all of our listeners. We have grown tremendously in the short period of time that we've started this podcast. We have 4,000 listeners all over the world. I mean, I look at the map of all of the countries that have one or more people listening to us. It goes all the way from Latvia to Mongolia, and all in between that. And some of the most war-torn places in the world, such as Syria and Iraq and Iran. So I have to thank all of our listeners all over the world for taking the time out to listen to what our very famous interviewees are saying about orthodontics and how they practice in their offices and some of the innovative things that they do. So thank you so much. Continue listening. And you can get in touch with me through Orthodontic Smiles Podcast at gmail.com. I'm always available to answer any emails. And I also ask you to subscribe to Orthodontic Smiles Podcast. It makes it easier for us to know how many people are listening. And number two, you'll get a notification that we put a new podcast up, and it makes it a little easier for you. So thank you so much for listening to Orthodontic Smiles Podcast. I'm very proud to introduce to you that I am having one of my courses that I give in the Tampa area at my office starting in November. The name of the course is Comprehensive Early Treatment Mechanics for the Growing Child. Now let me explain this. This has been evolving over a period of time, this course, because we have courses at the American Orthodontics Society that will specifically take you through learning to place brackets and diagnose and treat out patients, but there wasn't any specific course dealing with early treatment orthodontics in a comprehensive way. And so we did have some pediatric dentists who asked if they could have a course that would teach them all the comprehensive things, but related only to early treatment mechanics. And so that's what I do every day of my life for the past 40 years. So we've been putting together this course, and we're going to do it in an office setting. So I think that that's what's going to make it unique. In this office setting, the participants, of which there can only be 15 participants in this office course, are going to be able to see the way we work with patients. They're going to be able to see the things that we teach, for instance, how to take good records, how to implement your staff into helping you produce a good product at the end of your comprehensive early treatment. We're going to go through every detail of what I do in my office, from placing brackets to taking impressions. And actually, they'll actually be doing this on dentiforms when they leave my office after a 3-session course, which will be in November 9th, 10th, January 11th, 12th, March 8th, and 9th of next year. When they leave this course, they should be able to very easily go out into their offices and treat early treatment, diagnosis, and treatment on the child from a very early age all the way through and up to where you might start a comprehensive course. So I used to refer to this as stop point orthodontics because I knew that there were some practitioners that wanted to treat children but didn't want to take it to the next level, didn't want to have to treat out in what we refer to now as phase 2 treatment. They just wanted to be able, perhaps the pediatric dentist just wanted to be able to treat phase 1 type cases and not progress on to phase 2. So we used to refer to that as stop point orthodontics. And so this will still incorporate these things and these ways of treating so that the practitioner can go on and take Dr. Brad Williams' course with the American Orthodontics Society that will carry them through all the way through to treating adults in a more comprehensive way. So if you have an interest in this type of course offered by the American Orthodontics Society in Tampa, Florida, you can get in touch with the American Orthodontics Society at orthodontics.com, and they can give you all the information. You can ask for any member of the staff at our office in Dallas, and they can put you on to this particular course. We've just about filled up half of the seats in the 15 limited positions. So if you're interested, now's the time to participate and get your registration form in. Before we move on, I think this is a great place to just take a quick break and hear from one of our sponsors.
Hi, my name's Dr. Brad Williams, and I've practiced orthodontics for over 35 years, and over those years, I've had some fantastic teachers like Dr. Bill Wyatt, Dr. Bob Garrity, Dr. Dave Jackson, and many, many more. And I'm honored now to be teaching orthodontics to a whole new generation of general and pediatric dentists. I want to personally invite you to enroll in one of my basic or intermediate hands-on courses through the American Orthodontics Society. We are committed to provide your entire staff the support and training you need to launch orthodontics in your pediatric or general dental practice. And to make the hands-on experience in my classes the best possible, I've partnered with an outstanding and very ethical company called OrthoArch to provide all the orthodontic supplies my students need. When my students start treating patients in their offices, they too will benefit as I have in partnering with OrthoArch for all their orthodontic supply needs. You can contact OrthoArch at www.orthoarch.com. See you in class.
Many times I have some of my students come back and they say that they're having a difficult time in their case presentation. Number one thing that happens in most cases is that parents who have had orthodontics done are preconditioned to come into the office thinking that orthodontics will be done on their child the way it was done for them. And that was probably 10 or 15 years ago. So a lot has changed in orthodontics, and I always kind of explain it to the parents that you remember when you used to have your gallbladder out, it would be a major surgery. It would take you'd be 3 weeks in the hospital. And nowadays you have 3 little small holes and you're out of the hospital in an hour and a half. So things have changed in medicine, but boy, have things changed in early treatment orthodontics. Now we deliver treatment in 2 phases. Phase 1 in the primary dentition or mixed dentition, and then phase 2 when all the permanent teeth come in, and that's where that stop point is, waiting for all those permanent teeth to come in. So having to present this to the parents is almost an art, because they're expecting one thing and you're going to present something totally different. And you have to do it with confidence. And by that I mean, if you're apprehensive in the way you make your presentation, the parents are going to be apprehensive in their acceptance. So I've put together a bit of a process that I go through with every one of my consultations. Now I realize I've been doing this for 40 years, so I've done quite a few consultations in my time. And I know that there are certain key things that parents listen for and key things that they want to hear and understand before they make their decision to let you, the practitioner, work on their child. So this is how the process works in my office. When one of my patients comes in for their 6-month checkup, I'll always do an orthodontic evaluation on them after we've done a clinical caries check. And if in fact I perceive at about age 6 or 7 that they have significant crowding in their primary dentition and in their anteriors that have erupted or having difficulty erupting, I will suggest that orthodontic records be taken on this child. Now, I don't just leave it up to my staff to go up and tell the parents this. I go up to the front desk when the parent is checking out, and I go through the reasoning for us suggesting early treatment orthodontics. I give them a pamphlet about early treatment orthodontics, and I give them a sheet that explains what orthodontic records are in very close detail, what we need to do before we start treatment. Hopefully what happens is that they make that appointment for orthodontic records, and I tell them there's no obligation. We're just going to take the records, we're going to do the measurements, we're going to do the computer analysis, and then in about 2 to 3 weeks, you come in with your husband, perhaps if the other parent isn't there, and the child, and we will sit down together in consultation for as long as it takes for me to explain to you exactly what your child's needs are. I'll explain to you how much it's going to cost, how long it's going to take, and what you'll be looking forward to for in the future. You are under no obligation to accept the treatment, but I think you have an obligation to the child to at least know what's wrong and give you some options on how to correct this. After the mom has made the appointment, they're booked out to come in for orthodontic records. My staff is the ones who are going to do the orthodontic records. I will, at the completion of all the x-rays and impressions and the things that we do need, I'll come over to the patient and actually do an intraoral orthodontic and airway evaluation on them. And we will prepare our diagnosis based on all the information that we've had after we've entered it into the computer for analysis. A couple of weeks after that, mom and dad and the child come into the office and we're ready to do our consultation. I always put the records up on my computer screen with the child's face with a happy smile and invite the parents into the consultation room for us to talk about them. I first ask them if either one has had any orthodontics done, because I want to be on the same page as them. I want them to understand I am aware that they may have had orthodontics done differently than what I am about to suggest for their child. So we want to be on the same page. So I say to the parent, if they did have orthodontics when they were 12, 13, or 14 years old, I always say, you might find it strange that we're sitting here with your child at 6 and suggesting to you that they need some orthodontic treatment. Does that seem strange to you? And most of the time they will say, yeah, it does seem strange. I thought you started orthodontics at 12 or 13. I said, yeah, that's the way it used to be. 10, 15 years ago, all cases were started at that age, but now that we're doing what we called two-phase treatment, early treatment orthodontics, we have to get started making the bones bigger to accept the permanent teeth so that later we will not have to take out 4 permanent teeth the way you probably had them removed. And I'll always ask them, did you have permanent teeth removed? And 9 times out of the 10, they usually say they had permanent teeth removed. Well, I said, I'm trying to keep that from happening for your child. So let's get on with it. And what we're going to do is we're going to go through some pictures and slides of your child, and we're going to look at those pictures through orthodontic eyes. I'm not going to look at your child and say she's a beautiful child. Of course she is, but I want you to look at the things that I'm looking at, the orthodontic problems that I'm looking at. So I might shine up the smile picture and I'll say to them, look at this picture. What do you see in this picture? And I said, of course you see your pretty child smiling, but I want you to look at what I'm seeing. Do you see any bottom teeth when that smile occurs? And of course, most of these kids have pretty deep bites and crowding. And I also say, see how narrow the arch is. The only teeth that you see when they smile are like the 4 front teeth. You don't see any of the back ones. That's because the arch is so narrow. So that's how we go about doing the consultation, looking at each individual picture from our records and talking to them about what I see and what the diagnosis is leading up to. People are visual. You can't explain the orthodontic process without giving them something to look at. It's difficult for me right now to sit here and talk to you about doing a consultation because I don't have my slides in front of me. So I'm having to kind of improvise in the way I'm speaking to you on a podcast. So the next step in the whole process to go through looking at each individual picture, pointing out the individual problems, then going and actually looking at cephalometric tracings. Now, I don't expect the parents to know anything about cephalometric tracing, but it's pretty impressive when you show it up on a screen. And I think that what they get from that is the idea that you went through a lot of trouble to make a diagnosis of their child, that there is a process to knowing what is going to be needed and how long it's going to take and what we need to do to fix it. So that's really impressive to a parent. And I think that that's what we need to do, is show them that the amount of money that they've spent on records is worth it. And I tell them, I said, these records are available to you. I can make copies of them for you if you want to have a second opinion. But I think by the end of this process that we will go through today, you'll have a good understanding of what I'm going to do for your child. Once I've explained everything on the pictures, I bring out a set of models that I've always kept close, and it usually coincides with the models that the child has. In other words, the crowding is significant. The models that I have, the crowding is significant. And then I pull out the completed treatment that I did on this particular child and show them the difference between the befores and afters of a child that had similar problems to theirs. They're usually quite impressed because it's visual. It's something they can see, something they can hold and touch and understand. Then I go and I pull out the appliances that I use mostly. In my case, I use most of the time upper and lower quad helix appliances. So we go through the process of how those work and how they're expanded and how over a period of 4 to 6 months the bone expands, and then we have enough room for the permanent teeth where we don't have to take permanent premolars out. That's the whole emphasis behind early treatment orthodontics. So now we're at that point where we need to start talking about whether or not we're going to proceed on with treatment. So I have like a few things that I'd like for you to just maybe jot down, and I call this the art of dental consultations. The very first thing you do when you're going to do a consultation is make a connection. Now, that could be anything. That could be if you look at the where the patient lives or what city they might be in. You may know someone in that city or that area, or you may have lived in that area before. So try to make a connection with them. This is done very often by just saying, oh my goodness, would you happen to know my cousin, Bill Elliott? He lives right near you. You might have known him. I know his kids go to the same school that your child does. Now, they may not know him, but you're making a connection. You may notice a very nice looking watch that the mom might be wearing. You can make a connection by just saying, that's a beautiful watch you have there. That's gorgeous. Where did you get it? Is that something that's from Europe or something? Because it really looks expensive. And little compliment, little things that make that connection to someone personally. And remember, I told you about getting on the same page. So number 2 thing that we want to make sure we're doing is we're getting on the same page. That's why I suggested to them that did they have orthodontics and did they have to have permanent teeth removed. The third thing is explain the problem. Well, that's when we showed the pictures and had them go through an orthodontic review of the patient through orthodontic eyes. So they understand what the problem is. That's not the way the teeth are supposed to look at this age. This is the way they're supposed to look. So you showed the effort. Number 4 is that you showed the effort that you went through to make a diagnosis on their child. That's appreciated. I can't tell you the number of times that parents look at it and say, I thought it was just putting wires in the mouth and the teeth got straight. I didn't realize that there's so much to this. The 5th thing, show them visually how you're going to treat. Don't just say, I'm going to put a quad helix in and we're going to expand the arch, or we're going to show them what a quad helix is. Show them what a rapid palatal expander is. Whatever you do, help them understand before you do it what you're going to use on their child, because they're apprehensive. Because the next question out of their mouth, does this hurt? And be honest with them and say, the first couple of days, the teeth may be a little sore, but a little Tylenol and softer foods will help. So another really important thing on the 6th thing that I'm going to talk to you about is explain to them that you have a window in time. Now, this is really important because you really do have a window in time to do early treatment orthodontics. When the lower incisors are coming in, there's a period of time where you can do some expansion. After 8 or 9 years old, the primary teeth are now starting to get a little loose, not have as much root in the bone, and so it's very difficult to do good expansion therapy when they're getting old. So they only have a period of time where they can have this treatment done. Once I've gotten past the first 6 items that we've just talked about, and I ask if there's any questions about anything that I've discussed, the next thing is critical, because they're wondering, they're sitting there just having heard this whole consultation, and they're wondering what we're going to do next. So giving them some guidance as to what's going to happen next is critical. You're building this platform that they are standing on, and you want to make sure that it's nice and stable and they understand everything that's going to happen. So you give them an explanation. Well, if you have more questions, Mr. and Mrs. Jones, I'm going to have my orthodontic receptionist come in and talk to you. But you're probably wondering what this is all going to cost. Well, let me explain to you how this works. This is phase 1 treatment. I'm only going to charge you for phase 1 treatment. It's going to take about 12 months, and the fee is going to be $2,800. Of course, that's not including your insurance, and it's going to be divided up over the 12 months. I'll send my orthodontic receptionist in. She'll give you a printout of all of the necessary things that you'll need to know to make your decision. Whatever decision you make, we understand. If you're having any problems with the affordability of this treatment, please let us know. There are ways that we can make it easier. If you have no questions, I'm going to take Joey back and we're going to start fitting some little bands on the back molars while you're discussing the financial dealings with our receptionist. That's called the close. And that's probably the most important part of the entire process. Having the child come back to have those bands fitted while mom and dad are in discussion with your orthodontic receptionist about the financial part of this treatment. You will know before you take that child back whether or not the parent is interested. They basically won't let you take that child back unless they are. So this is the close, and that's the most important part. So let's review the art of a dental consultation. There were 10 steps. The first one, make a connection. Number 2, get on the same page. Number 3, explain the problem. Number 4, show the effort in your diagnosis. Number 5, show visually how you will treat. Number 6, explain the window in time. Number 7, explain what to do next. Number 8, give them a fee. Number 9, we can make this affordable. And then the last and most important, number 10, the close. We've had over the years about a 93% success rate with our consultations. I think this will improve yours. Try some of these, and I think you'll have a higher percentage of closing your consultation. This is your host, Dr. Ed Gonzalez. I want to thank you for listening to Orthodontic Smiles today. If you enjoyed our broadcast, please click the subscribe button. We'll be in touch with you in the future about our further broadcasts. Thanks for listening.